Good morning, students. Myself and Dr. Indira, dealing the course Probiotics and Functional Foods, Module 1, Unit. Today we'll see the topic that is the prebiotics and health benefits. So in the previous class, we have seen what are the prebiotics. Prebiotics are nothing but the non-digestible substrates which activates the growth of the gut microorganisms, particularly the beneficial bacteria or the probiotic organisms. So these are non-digestible in the small intestine, transferred to the colon where digestion of the prebiotics taken place by the probiotic organisms. Come to see the prebiotic health benefits. So if you see the human gut microbiota, so it involves a cascade of activities essential for body health. So their imbalance can lead to the metabolic abnormalities and that leads to the various disorders. So prebiotics have emerged as an effective non-pharmacological approach to re-establish the gut symbiosis and promotes the well-being. So these are non-digestible fiber compounds found in the foods and composed of oligosaccharides. They stimulate the growth of normal gastrointestinal flora, which in turn hinders the growth of abnormal flora as well as the pathogens. So common examples include fructooligosaccharides, inulin, arabinogalactan, polydextrose, lactulose, and lactidose. So these prebiotics, they resist hydrolytic activity in the upper part of the gastrointestinal tract and thus reach the colon in an intact form. Here, they are subjected to selective fermentation by beneficial microflora, which ultimately changes the composition of the colonic microbiota. So, if you see these prebiotics, they stimulate the growth of bifidobacteria and lactobacillus, which confers several beneficial effects on the host, improving the digestion and strengthening the immune system. Here, the health benefits are mainly attributed to increased production of the short-chain fatty acids. What are these short-chain fatty acids? These are the chief end products of the prebiotic fermentation. They play an important role in modulating the intestinal barrier. So they involved in regulating the immune system and inflammatory response. So these prebiotics are not only modulators of gut microbiota, but their potential is being harnessed in a number of diseases such as colorectal cancer, inflammatory bowel diseases. They aid in the absorption of several minerals and helps in the prevention of obesity and relieving constipation. And to see the effects on the immune system, the beneficial effect is the stimulation of the immune system. These microorganisms, the beneficial microorganisms, they impact multiple aspects of the innate and adaptive mucosal immune system. So these effects are direct and indirect by increasing the population of beneficial microbes or probiotics, particularly the lactic acid bacteria group and bifidobacteria group. So these prebiotics, they stimulate the activity of the gut-associated lymphoid tissue, nothing but the gut, which confers a state of well-being and reduces the risk of disease. Come to the colorectal cancer prevention. So these prebiotics, they prevent the colorectal cancer by modifying the composition or activity of the colorectal microflora. How they will modify means they produce short-chain fatty acids, and these short-chain fatty acids and their modification of gene expression in cancerous cells are the major mechanisms throughout to be responsible for anti-cancer activity. So many epidemiological and preclinical studies have demonstrated reduction in the levels of various biomarkers of colorectal cancer after administration of these prebiotics. And come to the inflammatory bowel disease, how these prebiotics prevent the inflammatory bowel disease. So one is the dysbiotic intestinal microbiota is the major cause of inflammatory bowel disease, and research is going on and new treatments targeting the gut microflora are developing. And here these prebiotics, they improve the gut mucosal barrier and modulate the microflora, helps in the prevention of inflammatory bowel disease. So it has been postulated that prebiotics nourish the bowel wall through the production of short-chain fatty acids and beneficial in Crohn's disease. In ulcerative colitis, they are assumed to decrease the production of hydrogen sulfide gas due to reduction in the number of sulfide-producing bacteria. These sulfide-producing bacteria are unable to thrive in the acidic environment, which is created by the short-chain fatty acids. And then these prebiotics, they relieve the constipation. How they relieve the constipation means they to activate the probiotics and produce the short-chain fatty acids. These short-chain fatty acids modulate the intestinal motility by exerting a trophic effect on the epithelial cells. So this ultimately leads to increased blood flow in the region and increases the intestinal motility and expels the unwanted or undigested material as a waste material in the excretory system. And prevention of obesity. How this prebiotics prevents the obesity means we all know that gut microbiota is involved in the development of low-grade inflammation, which disrupt the metabolism of glucose and absorption of fats. These disruptions are distinctive features of the obesity. So here prebiotics, they improve the gut barrier integrity and reduce the intestinal low-grade inflammation and ameliorating the metabolic alterations and promoting the weight loss. So studies have linked prebiotics with increased secretion of satiety, promoting peptides. Examples are the glucagon-like peptide 1 and peptide YY, and a decreased production of ghrelin. This is a peptide which promotes the appetite and adiposity. So these combined effects of prebiotics may have the therapeutic potential for obesity. Then cholesterol lowering effects. The cholesterol lowering effects of prebiotics are mainly due to the production of short-chain fatty acids by prebiotics. The short-chain fatty acids generated are absorbed in the portal vein and metabolized by the liver, resulting in the lowering of blood pressure. So prebiotics are involved in the absorption of fats and phospholipids in the lower intestine. This binding effect of prebiotics leads to decreased levels of cholesterol. A decreased level of cholesterol increases the clearance of LDL cholesterol and potentially reduces the blood pressure. And next, another important health effect is the improvement of absorption of several minerals. Not only all these effects, these prebiotics, they improve the absorption of minerals such as calcium and magnesium, which in turn has the beneficial effects on the bone mineralization. The short-chain fatty acids produced by prebiotics, they helps in the acidification of the gut lumen, so which increases the solubility of the minerals in the gut and leads to the expression of calcium-binding proteins in the large intestine. This is the mechanism of action of absorption of several minerals in the gut system. While the impact of nutrition on health is well established, prebiotics are underappreciated. Dietary components supports the metabolism, promote the gut health, and offer a non-pharmacological approach to addressing the disease associated with microbiota imbalances. Thank you.